I've seen a lot of people that did their practicum in one of the best recommended places. But when it comes to presentation and the writing of their reports, they went from top to bottom. They couldn't do it. So on today's episode, I'm going to be sharing with you a step-by-step guide on how you can actually prepare your seminar and your practicum reports and presentation, what to include, what not to include, following the updated guidelines, so that of course you can impress your supervisor or the panel that will judge you on that day you'll be presenting. If you stay to the end of this video, I'm going to be sharing with you the exact practicum template and presentation that me and my colleagues use that actually earned us a high mark. It's a done for you template that you can just easily plug in your details, and then it will save you a lot of stress trying to create your practicum reports and presentation from scratch. Did this sound good? Let's dive in. This is your first time of getting to see me. My name is Janina Izikai. I'm a public health master student of NOUN, and on this channel, I teach and simplify public health materials, helping students to understand their courses, pass the exams, and stay motivated throughout the academic journey. If this sounds like something you'd like to see more often, please don't forget to subscribe to the channel and click on that notification so you get to know when I post new academic videos like this. Okay, so this is the format you can use in writing your seminar. All right, your seminar report. Now, first of all, you have your title page. I'm going to be showing you this like a practical or using my own seminar report. So, and you can see marks are allocated to every content you put on your report. You have to be very, very intentional when you want to write it because every marks matters. Okay, you start with your title page, and they said you should include the topic, not more than 20 words, the names, the matriculation number, date, and a whole lot. So you also have the abstract, not more than 250 words, and this should include the background. I'm going to show you the mistake we made when writing our abstract and how you can also avoid it. Then you have table of contents, your introduction, body of the work, conclusion, recommendations, references, appendices, if there's any, and then the total will earn you 70 marks. So the mistake we made when we were writing our abstract is that we divided our abstract. The guidelines said the abstract should be in a block form. Your abstract should just be in a one block form, in one paragraph of say to say. Okay, so this is how your abstract is supposed to look like and not divided. Okay, and it should not be more than the recommended pages. So you can see your table of contents should be well arranged. Your table of contents, everything you write, your details, your page. Then also note your seminar report is not in chapters, it's in sections. Like here should not be chapter 1, it's going to be section 1. Okay, that's another mistake we made, and I don't want you to repeat it again. It should be in sections and not in chapters. Section 1, it should contain your introduction, background of the seminar. It should also contain the public health importance of your seminar topic. It should contain the rationale for the seminar, aims and objective, the general aim, and then the specific objective. It should be up to 3 to 5 specific objectives. Also, the scope of the seminar should be there. The scope of the seminar, okay, is the last one. Then when it comes to section 2 is basically literature review, you reviewing other people's work. So section 2, you're going to divide it according to how you're able to write. It's based on your topic, okay? So you have the literature review for section 2, and then you can add pictorial diagram if there is need for that. So these are the different divisions we did for section 2. And then let me take you to section 3 so you can see what is actually required for your section 3. For your section 3, you have conclusion, okay? Section 3, you have your conclusion, your recommendations. Then section 4, you have your recommendations, and then the last but not is the last one, which is your recommendations. Okay, so section 3 is conclusion, section 4 is recommendation. Then you have your references. All of them is going to be on the same report. If you don't know how you can edit this in your seminar report, how to edit your title page to be in the same document, your title page, the body of your work, your references, appendices to be in the body of. I've made a video on that. I'm going to be leaving the link in the description so you know how to add every details of your work in one document. Okay, so your references is going to be the last. I know you are using, as a public health student, you're going to use the APA style with the first line hanging like this. So when you come to practicum doesn't, because it's more of creativity. It's not something you're going to copy online. It's something you go to the field and do, then you come and report that and show evidence that actually do it. So the practicum is going to contain title page, executive summary, table of contents, your introduction on how you actually did the practicum, summary of activities, discussion of activities,
program impact, and a whole lot of them. Okay, so don't worry, what's the end of this video? I'm going to be sharing you how you're going to be getting a practicum presentation and reporting templates. Okay, because practicum is more creative work than seminar. Seminar is where you can actually go online and write what other people's have written on that. Okay, so let's me quickly talk on your presentation. You want your presentation to be very simple and clean. It should not be overcrowded. You can see on the screen, this is a part of our seminar presentation. It should be very simple and clean. It should not be overcrowded. It should contain only the key points. That is why it's called PowerPoint. It should contain only key points, and you should also use slide that is very easily readable. Don't overcrowd, don't overcolor your presentation. Okay, it's very easily readable, because most people that will come in to supervise you, you don't know if they have color blindness or they have issues with colors. So don't use anyhow colors for your presentation. And most importantly, you have to be confident when you're presenting. Practice, 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 practice explaining your activities confidently, so that when you're presenting, you not go and be blabbing.
So if you follow these guidelines I mentioned above, your practicum and your seminar will come out very, very good and impressive. If you want to save yourself the stress of starting from scratch in writing your practicum report and presentation, I've created a ready-to-use template for you. And this template, it contains editable Word documents, professionally designed presentation slides that is well structured, and also a complete guide section that tells you what you need to do and what you need to impute at a particular point. So all you need to do on this template is just to plug in your own details and where you actually did your practicum and everything. So it's already a structured and well updated template based on experience and also feedback from the supervisor and the panel of judges that actually supervise us on our own day. All right, so if you want to get this template, I'm going to be leaving the link to get it in the description, and I promise you it's going to be for a token, but it's not going to be more than a shawarma price. This is going to save you time, it's going to save you the stress, it's going to save you the guesswork, the hard work of starting from scratch again. I hope you really enjoyed this video. So thank you so much for watching, and please don't forget to like, share, and most importantly subscribe, so you're getting notification on when I post new and amazing videos like this. I'm going to see you in the next video. Bye.